Hi everyone, welcome to our second seminar of the Health and Terminology and Interoperability Standards seminar series. And I'm delighted to have a good friend of mine, Dr. Alejandro Lopez from SNOMED International, here with us today. My name's Linda Bird. I'm an adjunct assistant professor here at the University of Victoria and also the instructor for the HIMP 597 course, which is hosting this seminar series. Before we get started, we will begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen, Songhees, Ko Sepsum, Esquimalt peoples on whose territory the university stands, and the Lekwungen and Wasanich peoples whose historical relationships with the land continue to this day. So, as I said, today is the second seminar of the HTIS seminar series, and the topic is SNOMED CT Trends and Latest Developments. But before we get to that, let's take a look at the next few weeks. Next week, we have Dr. David Hay presenting on HL7 structured data capture. And then in the fourth seminar, it will actually be on the Thursday, July the 3rd, to avoid Canada Day on the Tuesday, July 1st. That seminar will be on Nursing Data Standards in Canada by Lynn Nagel and Peggy White. And then finally on July 8th, Debbie Pinter, Debbie Onus and Laurelie Lawson will be presenting on building better health records at Alberta Health Services. So there's a few great sessions to look forward to. And just to note that these sessions will be recorded and shared on the school's website. And just a reminder that the application deadline for the Health Terminology and Interoperability Standards Certificate has been extended to July 1st. So if you're interested in enrolling in that, please enroll soon. This is a one-year part-time program with 4 graduate level courses, including this one, which can be done through weekly online evening classes plus a virtual workshop. So if you are interested in applying, please either scan the barcode or go to uvic.ca/HIMF and click on certificates. And so now I'm delighted to introduce my friend, Dr. Alejandro Lopez from SNOMED International. Alejandro is a family physician and medical informatics specialist trained at the Hospital Italiano at Buenos Aires in Argentina. For the last 20 years, he has collaborated with different digital health projects worldwide, contributed to international working groups on standards and interoperability, and consulted on implementing national digital health agendas. As National Director for eHealth in 2019, he was in charge of designing and implementing the National Digital Health Strategy at the National Ministry of Health in Argentina. He was a World Health Organization Digital Health Technical Advisory Group member from 2019 to 2021. And he is now a Senior Implementation Specialist at SNOMED International. So with that, I will pass over to you, Alejandro, for your presentation on SNOMED CT trends and latest developments. Thank you so much for joining us, Alejandro.
Thank you very much. Thanks, Linda, for the invitation. And well, I know I'm part of the SNOMED implementation team just because of Linda. Linda brought me to the team and she was starting the team a few years ago. So it's a pleasure to keep working with you, Linda.
Thanks, Alejandro.
And so, thank you. And every year we present like a brief glimpse of all these new aspects of SNOMED CT. And for this year, I thought that the update for the previous year was really good. So I added a few things, but I maintained everything. So it will be a long presentation, not in time, but with many slides. I will try to go as fast as possible through them without confusing you. Please stop and ask any questions in the middle if you need. The idea today we will go through how SNOMED collaborates and contributes with other standards, how we can create advice and we publish documentation about how to implement things, how we rely on our clinical reference groups, some of the best practices, and we will point you to some free and open source tooling that is available to use SNOMED. So one of the most important things that happened, it was the actual release of SNOMED alone. The year before we presented the preview, how SNOMED was working with LOINC, how they will work together, but now it's a reality. And this is the fruit of a collaboration between SNOMED International and registry, which is the outsource maintainers of LOINC. LOINC is this vocabulary for laboratory information systems, usually for orders and procedures reported in laboratories. Yes. So the organizations work together to harmonize how they work. Yes. And this resulted in the LOINC extension. So now LOINC has two representations. You can download the laboratory vocabulary from LOINC as the classic LOINC structure file, or you can download a SNOMED version of the same content. Yes, the SNOMED version is an extension of the international edition, and it has been released in 2024. I need to add the title. And the new extension contains 35,000 concepts. Yes, 35,000 new concepts in SNOMED that are an SNOMED representation of the LOINC concepts. All the concepts added in this collaboration are of the kind of observable entities, something that you can observe. Then it's not a procedure. Usually that's a very typical discussion, whether when you order a laboratory procedure, you're ordering the procedure or you're requesting the observation of an observable. And usually the results are reported as observables with value, and sometimes the order are ordered as a procedure or as an observable. This is something that is every country around the world is making decisions about how to represent these things. But LOINC there are observations and they're represented as observables in SNOMED. It's 35,000 concepts. There's a page, loincsnomed.org, that you can visit and you will see everything about that. There's a special browser that is just like the SNOMED browser, but it contains special features so you can see the LOINC codes and the SNOMED codes at the same time. So when you go to a concept that is, for example, substance concentration of glucose in arterial blood at point in time, you see the LOINC code system code there along with the new SNOMED codes. These two codes are equivalents. Yes, you have the two codes in the same concept. And one of the descriptions, the one below, says glucose colon SNC colon PT colon blood A colon quantity. Is the typical LOINC description is now included in the extension as well. But also verbose and human readable description were created using an algorithm to populate the SNOMED extension. So this typical LOINC text is translated into a SNOMED fully specified name as substance concentration of glucose in arterial blood at point in time. So this is a reality now. And if you work with systems that need to work with SNOMED and with LOINC, now you have the ability of using this extension that combines both. And if you want to see how it looks in the development, in the implementation team, we usually try to explain how you can take advantage of SNOMED features. And to do that, we create documentation, and sometimes we create demonstrators. And this is an example of a demonstrator. So if I click there, you can go here as well. And you can see how LOINC and SNOMED could be used at the same time. So if you type something like glucose there, you get all the LOINC extension concepts. Each one of these is a LOINC code. So I click there, and on the right, I get all the elements, yes? And the specimens are calculated automatically, and I can click here and change either I want to see the SNOMED code or the LOINC code, because these are mapped. It's an example of an order. And if I want to filter, for example, I see all the glucose orderables are here because there's like an orderable reference set. So in this case, it's implemented in a way in which you can only order the things that you can actually order. But when you observe, maybe in the laboratory, they may send additional codes because some of the orderable codes are decomposed into additional code. So this distinction between orderables and reportables or observables is part of the SNOMED extension as well. And you can filter. You can say, I want to see only the quantitative ones. And you get like a shorter view. Yes, or from the quantitative, I want to see the ones that are actually pure glucose. And from these, the ones that are in blood. Yes, and you make a shorter and shorter list. Yes, so this is an interesting way in which you can implement. And all of these, like this order, can be converted into a FHIR resource. Yes, and in the FHIR resource, this is a service request resource. And you can see here in the coding that you have both. You have the SNOMED coding and the LOINC coding for each line. Yes, FHIR has this feature that allows you to submit more than one code for the same clinical idea. So when you convert these clinical orders to FHIR, you can use these tricks. And the same for results. When you see the results, these are no longer orderables, but they are rather the reportables or observables, and you have the diagnostic report that looks like this, or you can see the human readable report. And this is just something to play around and see how this looks in the real world. Yes. Also, SNOMED keeps working every year into improving the use of SNOMED and the IPS. And the IPS is the International Patient Summary. This is an important project. The IPS is an international initiative that tries to provide a healthcare summary that is minimal and non-exhaustive, tries to be specialty agnostic, condition independent, but still clinically relevant. It should be simple and implementable. The idea is that can be used in any place by anyone. The interesting thing about the IPS is that it was designed to be international and to be shared cross-border between countries, but many countries use it internally, and even Canada is using it internally to communicate between provinces or maybe to communicate between hospitals. It's like a package in which you can summarize different things, yes, like diagnosis, allergies, immunizations, and all. SNOMED has different resources to provide the information you require for the IPS terminology or for the IPS resource. And one special thing is the IPS terminology, yes, because if you have full access to SNOMED because you're in a member country like Canada, you can use any code in SNOMED to create an IPS and to fill all the fields in an international patient summary. But if you are in a non-member country, it's possible to use a free subset of SNOMED. That free subset of SNOMED is a small set that contains 15,000 concepts, think that SNOMED has only 400,000. So this is a smaller set, but this smaller set is created based on use reported by many providers. It's a mix of information from Europe, from the US, and from Asia. So based on that, like this core set was selected, initially was selected by the National Library of Medicine, and then it evolved as a sample that is continually improved by the IPS group in HL7. So the idea is that this is a free alternative to use the IPS between countries. SNOMED has 50 member countries, 51, I think now. But the idea is the IPS is global. So you should be able to use SNOMED all around the world, but you just use different editions. And this is a reality because SNOMED is extensible. So every time you define some constraint to say, okay, this field of the IPS, for example, this like the condition field, could be a critical finding, an event, or a situation. So if you use the pure international edition, maybe you have 124,000 options. But if you have the Canada or the US edition, you have a few more, yes, because this is related to the extensions, to the need they have to create new concepts in this realm. But if you use the free set, the IPS terminology, you have 6,000 or 7,000 concepts. It's smaller, but are the most important concepts in that set. And there's a way in which SNOMED allows you to use the hierarchy to convert from one to the other. So if you're a user of the IPS terminology and you receive the international concept that is not part of the terminology, like opercular epilepsy, which is a very particular type of epilepsy, you can do an operation in a terminology server that will translate this code into a code that is part of the international edition. For example, opercular epilepsy may be translated to localization-related epilepsy in the free set. So in this way, you can communicate the whole level of detail using the international edition or even a national edition, or you can summarize and generalize to communicate in this smaller set that is freely available around the world. And this is a feature of SNOMED. There's a demo for this as well. You will receive this in a PDF and you can click there and you can search in all the different things like the problem list, immunization, the procedures, the medication, and you can compare how this looks using the different terminologies. We are also working a lot in FHIR questionnaires. Yes, so give me 1 second. Okay, resolved. I saw in the presentation by Linda that in the next class, you will have David Hay talking about HL7 structure data capture. This is it. This is you will see this with him with much more detail. The idea is that you can have questionnaires, and the questionnaires you can define form, and then the response is stored in a different resource, which is a questionnaire response resource. The National Library of Medicine of the US has an editor that is really good to create these questionnaires. So we worked a lot with them to include SNOMED support in the form builder. Yes. So now you can assign individual codes, or you can assign ECLs and have dynamic list values to define the yes. And the structured data capture implementation guide that you will see in the next class is very good in this to be able to exploit the information in the response resource and being able to integrate that into your clinical record. You can transform a questionnaire resource into patient observations, patient conditions, and things like that, following that guide. And the guide also provides a lot of additional features to the questionnaires, like conditional display, connection to terminology servers, and something like that. So you will keep seeing this, and this is really good. And we devoted a lot of effort to work improving this form builder. That is really good. And you can play around with the form builder and create your forms. Yes. And the idea is that you can define things like this. This is a question, for example, the histological tumor type. You can assign a code to the question, a SNOMED code, and you can list a number of SNOMED codes to the answers. And this will be displayed in some way. But what we did was work with them. So instead of listing the individual options, you can create an ECL. And I think Linda has talked to you about ECL previously. You can say, okay, all the kind of this concept or this concept or this concept or descendants or the concepts that have this attribute, you can use an ECL to define the list of acceptable values in a form. Yes. So because this is a very good way to represent this structured part of EHRs. You know, EHRs have like generic forms in which you can put the diagnosis and some text. And maybe when you go to a specialty, they need a special form with a lot of additional information. So questionnaires are really good for that. But it's a challenge because when you create a questionnaire, the questionnaire is like fixed in time. And you need to be able to dynamically update the questionnaire if any of the reference concepts is inactive, for example. So what we did was to create a tool, which is called this questionnaire validator, in which you can upload a questionnaire, you can store it in any linked Fire server, like Happy Fire server demo, for example, and you can validate each one of the questionnaires to detect inactive concepts and things like that. So take advantage of that next week when you see that class. It's a great way to implement SNOMED, and there are many interesting things to do. And this tool about the validation is really useful. One of the examples of application of that was to use the questionnaires for cancer synoptic reporting. We have a group inside SNOMED. We have clinical reference groups. And one of the groups is a group of pathologists that work on how to structure cancer reporting. Yes, and there is one organization that is International Collaboration on Cancer Reporting that has a role similar to the College of American Pathologists in the sense that they create forms or validated forms that have a standard way to represent this information. So if we start from an ICCR paper form, for example, this is for a carcinoma of pancreas. You can see how you have the neoadjuvant therapy, the tumor site, the operative procedure. And the goal of this group was to ensure that SNOMED has the right level of detail to represent all the values in the questionnaire, but also to provide users with like a ready-to-use way to implement these questionnaires in your country. Usually, cancer registries require this kind of forms. Sometimes these forms require some local adaptation in each country. And this is done through FHIR questionnaires. So what you see on the right is a FHIR questionnaire representation of the paper form on the left. Yes. And this is really interesting because, for example, a National Cancer Institute can define the questionnaires and adapt the questionnaires for the country, then the clinicians will see the questionnaires on the EHR and they will be able to enter all the information. Yes, and this is very easy to do because there's a FHIR questionnaire widget in which the developer of the clinical system doesn't need to render, to create new software to render the questionnaire. It just uses a library and the questionnaire will appear almost automatically in that tool. And then the clinicians can enter the information, the EHR will save the questionnaire locally, it can expand the information to conditions and to observations and all that. But that response is also communicated back to the National Cancer Institute where they can build the cancer registry, yes. So the institute defines the questions, the clinicians fill the responses, and the institute receives the responses. So this is the typical implementation scenario in many countries, for example. And in a similar way, other group, like this group of pathologists in SNOMED, a different group, is a group with allergologists and immunologists. And they work on how to best represent allergy and hypersensitivity. And this is a nice example of how SNOMED grows based on the clinical needs and on the experts that form part of the SNOMED community. So this group got together and wrote a guide that explains how to represent allergies using SNOMED. And this is based on standard format like FHIR, again, yes. So what we did to demonstrate this was to create this tool similar to what we saw in lung, yes, in which we have the allergy intolerance resource, and following the recommendations from the group, you say if you're allergic to aspirin, you can type aspi, and it will only be linked. This is linked only to propensity to adverse reactions, right? So you say allergy to aspirin, the type is automatically identified based on the hierarchy of SNOMED, the categories and medications. So if instead of aspirin, I do like, I don't know if shrimp is here, allergy to shrimp, yes, it changes to food. Yes, it's hypersensitivity, and the category is food. And you can say this is confirmed and is high risk, and the manifestation was like this edema of glottis, and the severity was moderate, and the exposure route was oral. Yes, and every time I choose something on this form, the information is filled on the right. Yes, and this is how you can go from the questionnaire to the response. And this is how the clinical groups work in SNOMED. Let me see if I click here, share sound and optimize for video sharing. There, there's a video in this part. BAMNI is a very interesting project. It's an initiative, yes, created by a consortium of different organizations and companies that work on combining different open source tools and creating a ready-to-use package for low-income countries, yes. So it's an open source suite of clinical systems. BAMNI project creates this package and maintains a package that is implemented in more than 500 sites in more than 50 countries, yes. So there are more than 2 million patient records using this. The core of BAMNI is OpenMRS, which is one of the most well-known and modern open source clinical record systems, but it's combined with other systems as well, and it has many adaptations. So it's like a special version of that. So the idea was that SNOMED wanted to contribute to this collaboration, adding SNOMED support into BAMNI, yes? And the idea was to create like an open source solution that will represent how SNOMED can be used.
SNOMED International.
So I think you can hear, right? You have heard the sound.
Yes.
Let me know if perfect. Yes. So I will play the
Yes.
video. This is a very short summary of how BAMNI works and some special features enabled by SNOMED.
SNOMED International and the BAMNI Coalition, a group of organizations that use, contribute to, develop, or implement BAMNI's open-source electronic medical record, are working together on a SNOMED CT module for integration with the BAMNI EMR to provide structured terminology openly to digitally maturing markets. In this demo, we are simulating a clinical visit. We start by selecting a patient from the list. It's a 65-year-old male with asthma, hypertension, and hypercholesterolemia. He presents to the visit with palpitations and fatigue of recent onset. We will use the history and examination form to record this information by selecting terms from SNOMED CT, powered by Snowstorm Lite, the integrated terminology server. In the consultation panel, we can enter a free text clinical note describing our reasoning. The electrocardiogram results showed atrial fibrillation. We record this primary diagnosis in the next panel, searching in SNOMED CT. The next step is to prescribe the necessary medications, beginning with dabigatran, an oral anticoagulant, to reduce the risk of stroke in patients with this condition. The medications panel uses the terminology server to search SNOMED concepts for the available medicinal products. The clinical decision support system has identified a potential interaction between dabigatran, the medication newly prescribed, and aspirin, which the patient has been taking until now. This interaction was detected using an interactions knowledge base developed for this project, and using the terminology server to compare with the medication ingredients described in the SNOMED concept attributes. We are also prescribing propranolol, a beta blocker, to manage the rhythm and alleviate symptoms. Propranolol triggers a different type of alert, a contraindication in this case due to the patient's chronic asthma. This alert enables us to revise our decision and prescribe atenolol instead, a similar drug that does not have this contraindication. This alert is also an example based on a custom knowledge base, which employs the terminology server to match with content encoded in SNOMED CT. Now we are simulating a data entry error. We have selected 2 tablets of atenolol to be taken twice a day, not realizing that in this system, it amounts to 4 tablets daily. A new alert informs us that we are exceeding the recommended daily dose. This alert is triggered by a knowledge base that uses the ATC-defined daily doses and leverages the detailed ingredient and strength attributes in the SNOMED concepts to calculate the total dose. All the clinical information recorded in the patient's history is readily available for reporting purposes. For instance, we are now going to generate a daily statistical report that includes the ICD-10 code for the primary diagnosis of each visit. This reporting feature utilizes the terminology server to access mappings published in SNOMED CT releases, a result of the collaborative efforts of SNOMED International with various organizations. For more information about this collaboration and the open source tools, please visit the SNOMED International and BOMNI websites.
So this is an interesting example because it's like seeing SNOMED in action, and in action in an open source software that you can actually use if you have a project or if you are required to provide advice in a low complexity environment. Probably this is a good idea. And this tries to highlight how you can leverage SNOMED for implementations that have a clinical impact. And when we show these interactions, the benefit of SNOMED is that you can define that any kind of asthma interacts with propranolol, and you can use any of these asthma-related codes. There are more than 100 types of asthma in SNOMED. You can choose any one of them, and those will all apply to the same rule that says any kind of asthma interacts with propranolol. And you can use all the ingredient information, strain information in the drug. So this is taking advantage of the definitional information in SNOMED, taking advantage of the hierarchies to compute these equivalences. And you can see how easy it is for the doctor to enter like a diagnosis or the name of a medication or something like that by searching the terminology server. And the terminology server that was mentioned was Snowstorm Lite, yes? And Snowstorm Lite is like a lightweight version of Snowstorm, which is the main terminology server provided by SNOMED International, that is specifically designed for these constrained environments in which you need to run the EHR and the terminology server and the database all in the same server, for example. So the idea is that you can leverage all the benefits of SNOMED without requiring the full set of technology. The classic terminology server is this one. It's a Snowstorm. It's completely open source. and it's the backend tool for the browser. All the demos that we have seen have Snowstorm backend behind it, and it's compatible with the Fire API. It's really powerful. It even works for authoring and for changing things. But for Bamni, we designed a very lightweight version of that. We extracted the main functionalities, and we created one that has a single edition. It does all the basic file operations. It does most of ECL, not every feature of ECL, but most of it. But you can do translates and things like that. And the idea is that Snowstorm Lite is so lightweight that you can create the index and run Snowstorm Lite only in 40 seconds from scratch. Install it, load the terminology, and make it available. And it has all the features that allows doctors to start typing and searching concepts constrained to a particular part of the terminology, like we have shown so far. So this is a really interesting tool to environments. And also, SNOMED provides a tool for creating refset and translation. This is an old tool, it has many years now. And every year, apparently, we're thinking that maybe we will replace it with a new one. But so far, it's still available. It's a very good tool. But the UI, maybe it's a bit outdated, but it's really good. And people can create ref sets or value sets here. They can say, okay, this list of concepts is relevant for this use case, and they can select concepts individually, or they can use queries and ECL to create these ref sets, and then they can publish and download the files of the ref sets. Yeah? So you can create the extension or intentional definitions, etc. You can use the tool also for translations. Yes, you can say, once I create a ref set, I can translate this ref set to a different language. So it's a very interesting tool that has a clear use case for many small implementations of SNOMED around the world that want to add a few more details to the SNOMED release. And WebLate is a more modern translation tool. Yeah, so this is more oriented to countries on the national level. Yes, you know, the 50 countries in SNOMED, not all of them have full translation. So many of them are still in the process of translating different parts of SNOMED to their local languages. And many of the new members from now on will not be English language countries. So they will need to work on translations as well. So when new countries start using SNOMED, we provide this tool in which they can identify each one of the concepts. They can use automatic translation from Google and from other providers, and keep creating local language descriptions for the SNOMED concepts. And the third use case, these are the basic use cases for creating and adding content to SNOMED edition, creating ref set or value sets, translating, and creating maps. And Snap to SNOMED is a very useful tool that is designed to be able to create maps. Yes, we have a new version from last year that has a simple login, has a better reconciliation and revision mode. You can either have like a sequence of reviewers, like say the author defines a map between a terminology and a SNOMED, and then that goes to a reviewer who looks at the map, verifies and accepts or rejects that. Or you can do it in parallel. You can assign the mapping task to two mappers, and they will both try to map at the same time. And depending on the results, that goes to the reviewer or not. If both mappers decide that they want to do it, they choose the same target, maybe that's approved automatically. If there's a difference, maybe you need some kind of reconciliation. Snap to SNOMED also provides tools for updating the maps. So this is the use case for Snap to SNOMED, is that you have like a local terminology for medications or for procedures or something like that. And you say, okay, I want to link this terminology with SNOMED. So you load that local terminology in SNOMED, and you work on the map, and you define the link between that and SNOMED. And you can extract like a mapping table from there. But maybe SNOMED changes because SNOMED is released twice every month, or maybe a national edition is released twice a year. And some concepts may be inactivated, or maybe some new concepts that provide better matches for the map. So Snap to SNOMED has features that allow you to identify when, for example, your map is outdated for some reason, and you can replace the targets of that map. Yes, there are a few other features, and one of them is to export fire concept maps. Yes, once that mapping table that you can download, also you can download it as a fire concept map that you can load into a terminology server and execute a fire translate operation. This is what it looks like when you create a map. Now you can select whether you would use a single author cycle or a dual author cycle. And when you export the maps, you can export all these formats. You can export to CSV, to TSV, to Excel files, to Fire, or some extended Excel format with additional columns. So these three tools are really useful, yes, but they give you different separate artifacts. You get a table with translation, you get a small table with your ref set, or you get these mapping tables. And these are like independent resources that you need to incorporate in your system. Sometimes you can use it as a file resource, or maybe you can load it in a database table or something like that. So one of the challenges, and Linda started with this idea when she was in SNOMED International a few years ago, was we need to be able to create an edition for a project or for an edition for an organization, for a hospital, to say, I collect this information and say, I have these maps, I have these translations, I have these ref sets, and I should be able to put everything together and package that as a SNOMED extension. Yes, so far it was complex. Before this, it was really complex to create a SNOMED extension. You need to use like a very complex platform that requires usually to pay for a service, either to SNOMED International or to private providers. And the idea of Simplex was that it should be possible to create a SNOMED release package without using the terminology tools provided by vendors or the managed services. There should be a way in which we can transform the output of these tools, the ref sets, the translations, the mappings, into a SNOMED release package for free. I mean, without requiring complex tools, yeah, and without the need to do it manually. So the philosophy of Simplex is that it's open to everyone. Everyone who needs to create an extension is allowed to use Simplex. They just need to request an account on Simplex. There are a few limitations so far that you need to do like a first level extension from the international edition. For technical reasons, this year is not yet supported to do like extension of an extension. So if you want to extend the Canadian edition, for example, there's something in the middle. You need to wait for next year, but this year is still not possible. But the idea is that this service should be really easy to use. Yes, so it's a generic service. If you want to use it, these are the functions, and you use it as it is. Only the most common and simple features are supported, and everything is organized in a way so you can use it by yourself. You can see the information on the screen, and you can follow all the process for reviewing, uploading the content, running like a validation of the content, detecting errors, fixing the errors, deciding where the content is stable for a release, then starting a release, creating a package, and downloading a package. Okay, so the idea is that the release will have the same quality as official SNOMED release, but is completely managed by the users. And using Simplex, you can publish the refset subsets using the refset tool, for example, or spreadsheets. You can publish maps using Snap to SNOMED. You can publish translations that you create either using the translation tool, the old one, or Weblate, both. You can import content from both to publish the translations. You can create new synonyms, and you can create small local concepts. Yes, if you want to create a new concept, that's supported by the tool, but only for very, very basic primitive concepts. Yes, the tool doesn't support yet for you to add relationships, attributes, definitions. This is a very important part of SNOMED, being able to define new concepts so you can detect equivalences, maintenance, and everything. But that adds several layers of complexity to an edition and to all the maintenance that you need to do on each release. So intentionally, the first cycle of simplex is to only add primitive concepts. Yes, maybe as a placeholder, and you have it as primitive concepts. And when maybe at some point in time you need more robust tooling, you can mature to a different tooling set. You can go to the SNOMED managed services, which is what SNOMED International offers to countries. Or you can go to private vendors that have software tools that will help you do that as a hospital or as an organization. And in that stage, you can take your primitive concepts and add all the necessary attributes. Yes. These primitive concepts will inherit attributes from the parents, but they will not have new attributes by themselves. Yes. And the idea is that everything is bundled into an edition. And the good thing is that once you have that, you can combine all this information and you can deploy it to your clinical information systems. Yes, we talked about Snowstorm and Snowstorm Lite, and you have seen how Bamni is able to search things in the terminology server and everything works fine. So simplex is the way in which you can translate, create ref sets, create maps, work on spreadsheets, and how you can combine all that and put everything into a terminology server. Yes, and when it's in the terminology server, it's available to your tools. It's available to your clinical users. Your users can search and they can find the concepts you created. They can find your synonyms or your translations, or they can leverage the maps to create reports or things like that. This is how it looks. Yes. So that was an idea of doing the demo. I don't know if we will do it if we have enough time. But there's a way in which where you can navigate all your artifacts, and you can, for each kind of artifact, you can upload files that you download from the different tools. So the idea of Simplex is that it's a tool that you don't use every day. Most of your work, you do it creating the ref sets, creating the maps, creating the translation. You work every day doing that. And just before the release, you go to Simplex and you upload all the files, identify any problems, and you fix the problems in the original tools. One of the interesting things that we did this year also was to progress the maturity framework of SNOMED. Yes, this is still in the final stages of approval. There will be a few more changes to what I will show today. But the idea is that it's important for SNOMED implementers to be able to assess themselves where they are, how good they are on different aspects. And for like regional offices or national offices, it's important to gather information from hospitals and from provinces and to be able to compare maturity between them and to say, where are we overall and which hospitals are doing better, which hospitals are doing worse, how we can help them, what is the path ahead. Previously we had a very simple 5-level maturity index. And over time, when this was trying to be used, we realized that it was not that easy to measure the same maturity in different stakeholders. So one of the key changes in this new iteration of the maturity framework was to say, when you start an assessment, and the idea is that this can be like a self-assessment of the maturity of your implementation, or it's something that you can do with us, with the implementation team, or maybe that a national team can do with a hospital or something like that. And you can use this as a guide to start the conversation about how much have you progressed in your SNOMED implementation. So I identified that the questions to assess maturity are very different depending on which kind of user you are. Either you are like a territory or a region or municipality or province or a country, that it would be like the member aspect, or maybe you are a hospital, yes, or an agency or something that works with SNOMED, or maybe you are a vendor that has a specific tool that works with SNOMED. And each one of these will have different questions. So if I'm a vendor, I can say, for example, this is the vendor A, and the tool is Open EHR1, something like that. And then this is just I will put my name to who is performing, and you can assign. This will create a report in JSON format that you can store, and then you can compare. So you can assign like a location. So if you search, you can say Victoria, Ocean District, Columbia, Canada. You can search any location to assign this this survey or this assessment to a particular point, so you can show them in a map later. So the idea is that, okay, I'm a vendor, and then this is my metadata, and then I say, okay, what I want to assess of this vendor. And that may change depending on different countries and dependent on different use cases. So the idea is we have identified relevant key process areas for vendors. And these areas are the scope of the SNOMED implementation, how the terminology is provisioned and maintained, about the usability and tool support, about interoperability, or about the decision support and analytics. And you can decide which ones of these areas are relevant for you. You say, okay, I don't care about interoperability. And so you can deselect that. So I will use everything because it's more rich. But when you start the assessment, the questions are selected based on the selected areas. So to assess the whole 5 areas, there are 9 questions, yes? So these questions, you have options from 1 to 5. The 1 is the lower maturity, and the 5 is the higher maturity. And you have the option to enter some comments on each one of these. Yes, so for example, it's implemented across clinical and administrative areas, or maybe only a few, or fully integrated across all areas. So I put 4. There are some comments on these sides. Is a SNOMED consistently used across documentation to support interoperability? Let's do a 3. How structured and automated the processes for updating SNOMED CT content? Is the updates are tracked, or maybe it's a basic procedure but lack automation? And you can, how effectively is SNOMED used are SNOMED CT updates localized and then communicated to users? Let's pick a 4, and let's pick a 4 on how user-friendly the search tool and interfaces are, and how effectively is user feedback integrated in the tool occasionally, how effective user supports data exchange, and you can assess, how are all decision support tools integrated with SNOMED effectively. And let's say this is a 2. What level of analytic capabilities are provided by SNOMED CT? So this is one way in which you can assess that. And when you finish all these questions, you get this report. You get an overall score from 1 to 5. So it's 3.3. So you're advanced, yes. This is the stage. You're basic, emerging, advanced, or integrated, yes. But in different aspects or different areas or KPIs, you may have different progress. You are advanced in many of them, but you're integrated in interoperability because your system is especially powerful on that. And you can see that on this radar chart, where you see the interoperability side is higher than the other. And you can download this as a JSON file and store this and submit that maybe to your region manager or something like that, or you can download a PDF. So this is an interesting way you can work. But also, this is coupled with a dashboard. Yes, and the dashboard, I will load some examples, is a way in which you can load several of these assessments and you can see them on a map. So in this case, we are looking at an assessment for this hospital, and this hospital. You can see the hospitals in the map. You have an overall maturity average, yes. You have the different scores compared on the table. You have the different chart diagrams for each one of them. The dashed line is the average, and the other colors are the results for each country. So you can say, okay, for each hospital. So in interoperability, the green is really the best, but maybe for user proficiency, the green and the purple are really similar, yes. And you can see on how for interoperability, the yellow and the purple are very similar. If you have a view. And this is like a summary of all the hospitals that you're working with. So this is like a tool that we developed and we provide to users for 2 purposes. One of them is to support self-assessment. And the other one is to help organizations that want to monitor and promote the adoption of SNOMED in a region and in several hospitals or areas can work with this. Yes. We are still missing maybe the feedback part. That was something that we also tried working with Linda to do a lot in the previous. The previous was simpler, but each level had advice about how to progress, how to improve. Yeah, so if you are level 2 in interoperability, what you need to do to go to level 3, 4, or 5. So probably there will be more and more information embedded in the tool later that will try to guide. After the self-assessment, you should have some kind of checklist or priority list of activities that you can do to improve your scores, for example. But also it's a nice tool, even if it's not a self-assessment, it's an interesting tool to do with a coordinator. Yes, so we as SNOMED International can sit down with the country and do the score and do a discussion around the results, or maybe a national standards office can do that with the province or with the hospital. And another demo that we added recently is this integrations demonstrator. This is also in development. The information is not perfect yet, but this is a diagram that we have in all our presentation and tries to represent how SNOMED works with other terminologies. Yes, so SNOMED has a map with EDQM, has a map with ICD-10, has a preview map with ICD-11, and has a map with ICDO, HPO, MEDRA, and also there are some ref sets created with some organizations like WONCA and general practitioners and family physicians with the nutrition care process terminology, or there are like some agreements to improve the content of SNOMED in dentistry, in cancer control, and things like that. So if I look for a concept here, like fatigue, for example, I have not used it today, so the terminology server sometimes needs to like create a cache of the responses. So the first time it may take like 40 seconds to work. So this is searching the whole SNOMED CT. And the idea is that when I select the concept, yes, we will see which ones of these collaborations between SNOMED and other organizations are related to this concept. Yes, it takes there. So I select fatigue and I see several of them are highlighted. So SNOMED fatigue concept in SNOMED is linked to ICD-10 with the code R53, and it's mapped to MEDRA with the code 116.257. Yes, MEDRA is the adverse events reporting vocabulary, but also it's part of the DICOM set. DICOM is the imaging vocabulary that is embedded into modalities, into the echography machines, tomography machines, radiography, things like that. So those systems have SNOMED codes inside. And for example, fatigue is one of the SNOMED codes inside that. Probably is one of the reasons for something in DICOM. It's part of the IPS terminology because it's a member of the IPS ref set. It's part of the general practitioner ref set, and it's part of the nursing vocabulary. Yes, with ICNP, it's International Council of Nursing Practice, I think. So you can see how one code is related to all that, but also you can click in one of them, like the Union for International Cancer Control, or let me see if I do this one. Oh, something is missing. Oh, probably it was updated in June. So I'm missing. It's looking for the May representation in the derivatives. But the idea is that if you click on these, you should see some options here. Yes, and these options are codes that are related to the effort. And the idea of this, when it works fully, is that it's something that we can use to show the members how SNOMED collaborates with other standards. Yes, that when you use SNOMED, you are not only using SNOMED, you are using SNOMED mapped to other terminologies, you are using SNOMED, but you have ref sets that identify relevant subsections for different professions and for different organizations. Or when you use SNOMED, you're benefiting from content that was created specifically by other organizations. So, for example, I clicked on ICD-10 and I get these codes, and I click this and I get the ICD-10 codes. Yes. For example, this is the rare disease. Yes, it's a syndrome that combines all this, and this has a code in Orphanet, which is the rare diseases vocabulary. And this Orphanet is in both sides. For example, because Orphanet, we have a map, so you can get the Orphanet code. But also we have an agreement with INSERM that if we don't have a code that they think is relevant, we create the code. So this code was created based on the input of INSERM, and this is the content project on the left. So the idea of this is to show you how it's like a live terminology that connects with all the rest. Yes. And also this year, if you want to learn more about all that we have been showing, we have a new implementation course. Yes, and the classic implementation course in SNOMED has two main courses for normal use, or maybe three. You have the foundation course, which is something that everyone that wants to approach SNOMED should do. It's a self-paced, completely free and open course that is very short. And if you do that, you have a good idea what SNOMED is, what are the benefits, how it's structured, how it's used. It's a very good intro to SNOMED. But when you want to progress, you have like two ways. Usually, there are a few more, but basically you have two main ways. One way is you want to work as an implementer, trying to see how I can put SNOMED in a system, how I can create advice about how SNOMED should be used. And the other one is how I can be a SNOMED author, how I can create content in SNOMED. And you have these two courses. Authors have level 1 and level 2 and a certification. And that's really interesting. And you can do that if you want to be an author of SNOMED content. But implementation is more for people who want to see how SNOMED works in a system. Yes. And the previous implementation course of SNOMED was really long. You have to devote many weeks to do the course. It was like a live course that you need to, there were like starting and ending dates, and there were commitments in the middle. So it was something very intense to do. You need to catch up, you need to be on time to everything, and you need to do the whole course. And maybe you were not interested in the whole course. Maybe you were interested in some aspects of SNOMED implementation, depending on your use case. So the progression of that was to create a new implementation course that is modular. Yes, you can do whatever of the small modules you can do by your own at the moment you want, in the order you want. If you want, you can do only expression constraints, or only data exchange, or only translating SNOMED. Yes, but these small modules, ideally you will do the basics. The first two modules, introduction and content and features, you need to do those. But after you do those, you can do whatever you want, and for the smaller ones. And these are organized into three like lanes. Yes, you have the general implementation and customization area, the EHR implementation principles area, and the extension management area. If you do all the modules of an area, you can do an assessment and you can obtain a certificate for one of the three areas. Yes, and if you do everything, you can get the full implementation course certificate. The idea is that this is much simpler now, and you don't need to do everything. We don't expect people to do the full course necessarily. Yes, maybe some people want to work on EHR and they just do the one in the middle. And maybe some people say, okay, I'm implementing, I want to extend the SNOMED, I want to use simplex, create maps, and you do this one only. And maybe some technical person that wants to package your edition wants to use the extension management one. So yeah, so this is interesting, and this is how you can navigate all the complexity of learning about SNOMED at your own pace and selecting your own path around that. And finally, we presented this last year because it's new. we created a game that is such a fun way to finish all these complex things that we have been describing. And this is a game that tries to demonstrate how you can do almost everything with the terminology server and the Fire API. So it's a word guessing game. Let me show you. We can click here. I haven't used it lately. Hope it works as expected. You can select different languages, yes, and you can click on new game. You can select the complexity, and the complexity is how many lives you have and how many hints are available. So let's do medium. And this is a very long term from the IPS terminology. This is retrieving the term in real time from the terminology server, yes? If I don't know what to do, I get a hint. So this concept has a direct morphology of an eMorush. Yeah, so I will start with that. Let's see if I more rush. I don't know. Split.
Oh, wait, I have it. No, I don't.
What is it?
I have no idea.
Traumatic. Yeah, trans. This is a procedure. So it's a complete transurate. Oh, there. Game over. Oh, I timed out. Complete transurate authorization of product, including postoperative bleeding procedure. So let's do it faster now. Yeah. No, but the medium is the time and the life, but it's not the complexity. So this one is it happens in the respiratory tract structure. If I don't know, I can ask for a new hint. I lose a life. So it's a kind of cough. Okay. So it's a kind of cough. So the interesting thing is that the chronic cough. Okay, I go to the next one. The interesting thing is that the hints come from the terminology server. Yes, these are the attributes. These are the relationships of the concept. And this is how, looking at the relationships, you can identify what I'm talking about. Yeah, so it's a specimen from the digestive system, cytologic material from head. Head? I don't know. Okay, no. Cytologic material from mouse. Okay. But this tries to communicate, to help you navigate the content of SNOMED, understand what kind of concepts are in SNOMED, how the relationships and the attributes describe the concept, and you can infer what concept is by looking at the attributes, and play around. And all this powered by Snowstorm on the back, Fire terminology server. So it's like a fun way to do it. There's a leaderboard, some people from Netherlands, from Singapore, from some companies. So you're V2I, so you're invited to play around this. Yes. Yeah. So let me go back to the presentation. These are the instructions and how it plays. So yeah, so this is the presentation. Thank you very much. And I think we can do some questions and maybe expand on some of the demos if you want, or something like that.
Thank you so much, Alejandro. It's great to see continued progress in all of the implementation demonstrators. I know a lot of people in the community really appreciate those. And also the work you've done on the Simplex toolkit. The fact that anyone can take a list of codes in a spreadsheet and implement it on a terminology server, I think is really sort of progressing things and accessibility to terminology for people. So thank you so much for that. Are there any questions from the audience?